It's chapter 12, page number 110, 110, chapter 12. So we'll start with the class. So usually there are various difficult situations which doctors face, but the most common ones, okay, they are the sudden death or any mob violence sort of situation. Patients who are brought dead and you have to give them a death certificate, or you have to sometimes be suspicious, you are in a doubt, should you call the police or hand it over to the medical legal team, send it for a post-mortem, okay, or you just have to declare the patient as dead. So that's a difficult situation. Then comes the settlement of bills, recovery of dues, okay. So our discussion for today's class will be based around these three areas largely, okay. So coming to sudden unexpected death, also called as SUD. Along the chapter, you will see lot of areas where they just use it as SUD, the abbreviation of SUD, which means it is sudden unexpected death. Okay. So what are the examples of sudden unexpected death? Like any death that takes place in the operation theater, on the operating table, okay, in the room while a treatment is going on, like hemorrhagic shock, neurogenic shock, cardiac arrest, endotoxic shock, any anaphylactic shock. Okay, these all are the examples of sudden unexpected death. Okay, so here the main important part is the sudden unexpected death is not caused intentionally. Okay, it was not by the intentional, purposeful action out of the doctor's hands. Okay, so this these kind of deaths are treated as accidental death. Okay, accidental death. It is not intentional death. Okay, air embolism, thrombus, any complications of anesthesia, these could also lead to sudden unexpected death. Okay, these are the areas. So death in the ward or room during the course of treatment, like during any intraoperative death or post-operative death, the family will be like very furious. They are not expecting this kind of news. They may be expecting that the patient is all well and good, and the patient is going to be taken care of. That would be the area the family may be looking out for. But if that's not the case, if they are witnessing a shock, they may agree in different manner. It's not always wailing and crying. They may agree with destruction of property, manhandling the doctor. Okay, that could be their first reaction. Okay, usually there is shouting or like any commotion, hurry, worry, or of the body language, etc. So when these things happen, the patient party will get agitated. They will see that the nurses are running here and there. The doctor is having sudden movements trying to save the patient, especially in ICU when you can see through. Okay, using the see-through glasses, the patient relatives can see through what's going inside. Okay, that could also lead them into a furious response or reactions. Okay, so what a doctor has to do under such situation, or how can a very how can you avoid an unexpected death? You should always keep the resuscitative measures, that is the code blue techniques, 24 hours ready. Okay, these techniques include ALS as well as BLS trained staff, resuscitation equipments like oxygen cylinder and defibrillators. Okay, these and the all the emergency medications, not non-expired ones, those should be ready in the emergency tray, etc. So keep the devices ready, and all the bystanders or relatives who are within the ICU or who are accompanying the patient when the patient goes into such situation, they are politely asked to move out of the ward or the room so that the doctors can carry out the resuscitation methods. Okay, and informing the relative uh, and the seniors who are present that this is a high risk case. This is now a high risk case. Okay, anything can go wrong. We are taking all the best measures we can to save the patient. Okay, and if the patient could not be saved, and the way how you break this bad news, okay, in a very polite but in a very empathetic manner, that means a lot. Okay, that could dilute the situation from getting into a heated conversation. Okay, so during the intraoperative death or post-operative death in the recovery room, that could also lead to mob violence. For example, Sinhania Hospital in Mumbai, there was a local Shiv Sena politician who passed away suddenly, unexpectedly. The entire political gang ganged up against the hospital and burnt the hospital down to ashes. Okay, that kind of situation did take place in the past. Okay, you can search about that in Google as well. The hospital's name is Singhania Hospital in Pune, Thane. Okay, and the person who died was a very good, well-known Shiv Sena party leader or some politician from that particular set. Okay, so with his sudden death, the entire political party ganged up against the hospital, manhandled the entire hospital, burned down the entire hospital into ashes. Okay, that had taken place. Okay, so how will the relatives react here? Mostly it is anger, anguish. Okay, they want immediate explanation. They want to charge a medical case against the hospital or the doctor. They want to destroy something to vent out their anger. Okay, these things can happen, and they want that, give us our money back. We trusted your hospital, we trusted your doctors, we paid you so much of rupees in lakhs or thousands, give us the money back, refund us our money if you can't save uh, our loved one. Okay, that could be a reaction. Okay, immediately they will call the media, police, spread the news, shame the hospital. Okay, so these there could be a verbal as well as physical abuse also towards the staffs. Okay, so you have to make sure the security is well set up in such situation. How the doctors can react in such case: run away from the area when you know, not running away like completely, removing everything, removing, escaping from the situation. No, you have to run away in the sense you have to emotionally detach yourself from this situation. When you try to explain them, when the patient's party is seriously agitated, angry, when you try to explain them, they are not going to listen. So run away here means completely emotionally detach yourself from the situation. Do not physically escape. Otherwise, situation will get agitated. If they can't catch you, they will catch someone else. They will destroy the hospital property. Somebody will suffer the burnt of their anguish. So physically, don't escape. Escape in the form of your thoughts. Detach yourself. No need to explain them over and over again how the situation happened, or give them the sequence of logistics that took place. That is not going to help your situation. Okay, that could help your colleagues understand how things went down, but the people who are in anger, who are in anguish, they will not understand. Okay. And unnecessary explanations, don't give them. They are not listening, don't give them unnecessary explanations, as well as settle the matter as soon as possible. Okay, and whatever unpaid bills are there, you can give them some discount, you can give them some relief under the hospital's policy. If they are able to pay up, they can, but otherwise you can see to it that some kind of relief, some kind of guidance can be provided in that area. And do not retaliate using abusive language. Okay, that could be recorded these days. Whatever the hospitals or authorities are doing, as a staff, what you're doing, what you're saying could be recorded in the mobile smartphones. Okay, so never lose your cool. Okay, sometimes when you are on the receiving end of abuses, okay, or you are on the receiving end of abusive languages, you may try to retaliate in the same way. Okay, so they may morph your image, or they may morph what you say. They may edit out certain parts and make you look like a villain, and that could disrupt your name in the society. Okay, among the colleagues, among the other practitioners, you may have to bear the burden of the shame. So don't ever try to retaliate with abusive language, words, or actions. So what relatives usually do in such situation, they try to manhandle the doctor, abuse the doctor, hit the doctor verbally, uh, physically, okay, destroy the property and the hospital equipments that could happen, threaten the doctor that I'll come after you, I'll come after your family, you will suffer the same way, something like that. They will threat the doctors. Okay, these things are expected. Okay, lodge a criminal complaint against the doctor without any basis, without any strong evidence. They can go and do that. Insist on arrest of the doctor, but it will not take place. Doctors are not arrested until and unless it is a non-bailable or non-compensable case. Unless that's the situation, doctors could not be arrested. Okay, invite the media and spread bad news about the hospital and the doctors and harm the reputation of the hospital and the doctors as well. Demand for their money back, okay, refund, etc. So on page number 112, you can see the example of Singhania Hospital. They have mentioned about the unexpected death of a high profile case of a Shiv Sena politician, Shri Anand Siddique. Okay, and after that, the entire hospital as well as the property was burned down to ashes. So you can just imagine if the entire hospital shuts down after such a disaster, what could be the impact of the loss of resources that they have occurred, okay, that they have to bail out of. Okay, so you have to avoid such situations. What the doctors could do in this situation, immediately call your colleagues or seniors, and always, if you are going, you are going to break a bad news, make sure that there are witnesses in form of your seniors or colleagues around, okay, when the explanation is being done. Otherwise, if they try to manhandle you and you try to be defensive, they may try to turn the table, turn the case against you, that you started the fight first, something like that. So it's always better to have witnesses in form of your colleagues and seniors around, and make sure that you have a task force around in form of some um, some form of security guards, etc., who can rush to the spot and safeguard your health and physically safeguard you from any physical abuse or any manhandling, mob violence kind of situation. And only if the situation gets out of your hand, at that point of time, immediately call for the police, ask for help from them as well. If the hospital's property is under threat, okay, immediately call for the police. There is no need to give repeated explanations, okay, of the logistics of how things went down in the operation theater or how things went down while the course of treatment. No need to give them explanations again and again, because the listeners here are not in the mood of listeners. Okay, they are not in the mood of listening. They are agitated mob. They are in a mob mentality state where they do not, they just react. They are not ready to respond. Okay, so giving them explanation is just a complete waste of your energy and time, and some words that you may use could be used against you also. So avoid that. Only responsible persons from the aggrieved family, that is next to the kin or spouses of a person who has passed away, children of the person who have passed away, close blood relatives, okay, only they are involved in discussing the case or breaking the sad news. All the other people, extended family or friends or colleagues present in the hospital, they are not involved, because that would lead, immediately it could turn over into a mob violence kind of situation. Be a patient listener in the form of what the aggrieved, what is the response and the reaction of the aggrieved family here. They could be crying, they could be like they could be begging you to do more. Okay, there could be something that you can do. They will be in a different form of trance. They themselves may not remember about it later. Okay, so be patient, be patient and be very cautious. Observe as well as listen. Observe in the sense, see that no harm is coming to your way. You are in a safe scenario. You have to make sure that prepare logical sequence of events with colleagues, so that if at all a case is being registered against you, there is a documentation of what went down. Okay, and cooperate with a legal arm. You will have a legal body supporting you from the hospital as well. Okay, they will be dealing with the case legally, so you have to be very cooperative with that legal arm. And also the advocates who the aggrieved family has appointed, you have to cooperate with them as well. And you can immediately certify the death. Okay, why this death took place, and immediately a death certificate could be made, because it could be used in the legal formalities as well. And immediately let the police take the body for a medico legal post-mortem. The human remains of the body can be taken for medico legal post-mortem as well. SUDs should be informed to the police, that is sudden and unexpected death. Like if the child, if there is any case of falls or people committing suicide, okay, such cases, you have to be, you have to inform it to the police. Any post-operative patients, um, uh, any death in the operation theater post-op cases, any death occurring due to anaphylaxis, that is allergy, okay, so severe allergic reaction to the drug. Any Steven Johnson syndrome, you can Google about that as well, what kind of syndrome this is. Post procedure event, for example, after an endoscopy, sigmoidoscopy, small lumbar puncture, etc. Taking, doing a biopsy, small procedures, small OPD procedures you have conducted, and even after that, SUD took place. Okay, any internal or external bleeding, any disseminated veins or arteries. Okay, post anesthesia, any SUV took place. These things has to be informed to the police immediately. Then you can also make sure you have this insurance policy as a doctor, medical indemnity insurance policy. This policy assures that the doctors, like, because dealing with the case going to courts, okay, uh, claims for compensation, defense cost, this comes with a huge amounts of money. Okay, so if you have this indemnity insurance policy, this policy will take care of those costs, legal cost, defense cost, claims of compensation. If you have to compensate the victim, okay, the insurance will take care of that compensation as well. Okay, so you can search about medical indemnity, Google about which organizations provide the best indemnity insurance in India, and you can go with that as well. Okay, so make sure that you are insured against any legal row, even if you have to pay the, if you are found guilty and you have to pay the compensation, the insurance policy will take care of the compensation as well. Okay, so this policy is there to safeguard the rights of doctors and to safeguard their practice. Next, come to how we should be breaking the news, okay, to the family member. It should be done very carefully. So immediately, sometimes it is necessary to declare the death immediately, so that they do not have enough time to find the integrity and respond in a bad manner. Okay, if when they are in a state of confusion, okay, what will happen, what may not happen, and immediately a death takes place, try to be quick, don't delay it. If you delay it, the family may claim that there is some foul play, the patient was okay a few minutes ago, you didn't respond something at that time, suddenly how can you tell the patient is dead. Okay, so don't give them the chance to accuse you for a foul play because of delaying the news. Okay, be empathetic, sympathetic, like your attitude should be in an empathetic way, and be cautious in communicating, be very respectful. Okay, because the family has lost someone, they the a huge wave of grief is going to hit them right now, so you have to be very empathetic of them and the situation they are in. So cover up, after cover up means, it does not mean you have to do manipulation. If there is manipulation, means something wrong was done by you. Okay, so here the cover up means that